ahead and get started. Good morning and welcome to the 2025 Empowering Health webinar series. This series will explore the intersection of health and technology, diving into the tools, challenges, and breakthroughs that are shaping how we care for ourselves and our communities. My name is Nerese Millette-Williams, and I'm the project coordinator for the University of Maryland Extension Marylanders Online program. And this event is brought to you by the University of Maryland Extension, our partnership with the College of Information, and in collaboration with the Family and Consumer Sciences partners. We have a great session planned for you today, and we're so glad that you're here to be a part of it. Before we get started, I just wanted to state that university programs, activities, and facilities are available to all without regard to race, color, sex, gender identity or expression, sexual orientation, marital status, age, national origin, political affiliation, physical or mental disability, religion, protected veteran status, genetic information, personal appearance, or any other legally protected class. Additionally, please see the following slide that includes QR codes for meeting the bios for our speakers, as well as their contact information, completing the conference survey, and then registering for additional webinar series coming up within this month. And you can also find these QR codes on our website, Marylanders Online, or your program agenda that was sent to you this morning. So I'm thrilled to kick off today's session, and we're joined by Diane Ducharme and Carla Beyer Smolin to discuss addressing disability disparities through health equity. Diane Ducharme is a program manager at the Image Center for People with Disabilities in Towson, Maryland, where she leads initiatives that support independent living and community inclusion. She also serves as an accessible telecommunications trainer for the Maryland Accessible Telecommunications, providing training on assistive communication tools. A dedicated advocate for digital equity, Diane works to eliminate barriers that disproportionately impact people with disabilities, promoting inclusion through outreach, education, and policy. Carla Beyer Smolin is a passionate advocate for hearing accessibility who lives with bilateral hearing loss in Frederick County, Maryland. Drawing on her years of service with the Hearing Loss Association of America, she brings both professional expertise and professional insight into improving communication access for individuals with hearing loss. It's an honor to have them here with us today. Please welcome Diane and Carla.
Okay, I guess that's our cue to start. So thank you. My name is Diane Ducharme, and Carla and I are going to talk about two sensory disabilities today, vision and hearing. And before I get into my presentation, I have a little story to tell that is relevant to hearing and vision. So my son is a UMD graduate, and he was at a party and he told me, he said, "Mom, I was talking to this girl and I said to her, oh, both my parents are blind." Now, I don't know if that's the best pickup line, but that's what he said. So he said, "Mom, I told her both my parents are blind." And she said to him, "Oh, do you use sign language to communicate with them?" And I was just like, oh my goodness, we're in trouble as far as people understanding sensory disabilities. So, needless to say, I told him run as fast as you can. So I'm going to start with a definition of inclusive healthcare. So inclusive healthcare means that healthcare should focus on ensuring that all people, regardless of your abilities, has equal access to services, information, and tools. So I'm going to talk about inclusive healthcare in relation to blindness and visual impairment. So the first thing that I want to talk about is how prevalent visual impairment is. That over 8% of the population, about 20 million people, which I think that's a little bit more because our population in the United States is even bigger. So it's floating around 20 to 25 million people in the United States have a visual impairment. And over 1 million people in the United States are considered totally blind, functionally blind. So that's a lot of people. So we need to take a look at how these people are being served in the healthcare system. And the first thing I want to talk about are websites, online forms, and telehealth. So a lot of healthcare providers think that their websites are accessible. Unfortunately, that's not necessarily the case. If you haven't had your website tested for accessibility by a professional website testing company, you may not know that your website is not. What happens a lot of the times is buttons are unlabeled. So as a blind person, I'm going through a website and I hear button, 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 which means nothing to me because I don't know what that button means. So the first thing I encourage you to do is get your website tested. Make sure that your forms are accessible. A lot of times they'll say, oh yeah, just fill out the forms on the website. I go to the website and they're not fillable. So that leaves me out of being able to do that. Telehealth, same thing. They'll send a person a link and then that link is not accessible to a blind person. Or they can click on the link, but again, all they hear is button, button, button. So that's the first step a lot of times. That's the first experience that a visually impaired or blind person has with a healthcare agency is, okay, I called and I made an appointment and you told me to do all this stuff online and it's not accessible. So right away, that puts up a barrier to the person who is blind and low vision. So I put in there that Vispero is the top-notch accessibility tester for websites. And Matt Ader, who's one of the presidents of Vispero, is a great contact person. So if you are concerned about your website, if you had complaints about its accessibility, contact Vispero and they can do a run through of your website and tell you what needs to be adjusted and what needs to be fixed. Let's label those buttons so that a blind person knows what they're clicking on, because I actually have gone through a whole form and get to the bottom and I hear button and I'm thinking, okay, it's not labeled, but I'm going to assume that means submit. Well, that meant cancel. So I had to do the whole thing over again to try to find then where that submit button was. So based on my experience, GBMC and Hopkins, their patient portals are accessible from the moment that I would register to being able to schedule an appointment, send a message to my doctor. I found that their patient portals are extremely accessible. So if you want to take a look at their patient portals and compare them to your own, that would be a good guide in our local area. So the second thing that I wanted to bring up is that the healthcare facility itself, your healthcare facilities can cause a lot of barriers. Many of them are huge. They're like college campuses. So that could be a first issue that somebody who with a visual impairment has, is getting dropped off at the right place. There's north entrances and east entrances and ground level and first level and all this other stuff. And so when giving somebody directions, if a blind person calls you and says, I need the exact address, please be specific on which entrance they should come in. And I'm not taking anything away from the blind person's responsibility as well. because we need to be our own self advocates. So if we are going someplace for the first time, we need to call and say, this is the first time I'm coming. I'm somebody with a visual impairment. Can you please be specific about the address? So if you get that request, then please honor that and be as specific as you can. Because also, as far as getting picked up from the place, we need to be able to tell the driver where to pick us up as well. So, to make your healthcare facility more blind friendly, um, include Braille signage. And also, in addition to the Braille signage, have large print and make sure that the large print is tactile because it's a big fallacy that every blind person reads Braille. Many, many, many do not, but we could feel the letters. So if your signage is raised, that will help as well. Train your staff. Train your staff to be inclusive to people who are blind and low vision. The biggest pet peeve that we have is when we walk into a doctor's office and the person at the front desk says, "Oh, well, who brought you?" Um, I mean, do you say that to everybody else who walks up to your desk? No. It's really none of your business who brought me. And second of all, when you say, "Oh, well, who's going to fill out this form for you?" Well, you are, because that's your job. So I, just please be mindful of that. It's required that you assist somebody who is blind and low vision, and making your staff know that this is a requirement. And also, it makes the blind person feel like they become a burden to you. So try to make the blind person feel as welcome as you would a sighted person who walks into your facility. Train your staff on sighted guide. Don't grab the guide dog, don't grab the cane. Ask the person if you could assist them. Ask the person if they would like to take your arm. The person then should tell you what their best mode of sighted guide is. But train your staff that that is an option. Um, Not having us fumble around and, you know, bump into walls that we weren't aware of. Just stuff like that. Um, Making your healthcare facility barrier free, which I know is impossible. There's stuff all around. There's gurneys, there's wet floor signs, all that kind of stuff. But just be mindful of them. And if you see, something that could be an obstacle to somebody who's visually impaired, just kind of move it. Another thing that is an issue is a lot of healthcare facilities do have escort services, which I applaud. That is so awesome that you provide that. However, when I get somewhere and they said, "Oh, would you like an escort?" Sure. Okay, well, sit over there. It'll be about an hour. Well, that's not going to fly because my appointment's in 20 minutes. So you may need to train more people to be escorts. Train your staff that, okay, it may not be your job to be a patient escort, but if you see a blind person, offer them some assistance. I've been in healthcare facilities, giant healthcare facilities, where people are like scurrying all over the place, and they have their head down, and they're probably like, "Don't make eye contact with a blind person. Don't make eye contact with that blind person because they're going to ask me something." And well, yeah, I probably will. And sometimes I will do that just because I'm like, "I hear you over there. Could you please help me find, the Wilmer Eye Clinic or whatever I'm looking for?" So I know it's not your job. It's not your responsibility, but have a little bit of, empathy towards the blind person that's fumbling around and help us out to where we need to go. So you can also use tactile maps. A lot of facilities will have those where am I and um, the directional maps. Make a tactile copy that the person at the front desk can hand a blind person so that we can orient ourselves to your facility. Some healthcare facilities have also created audio maps so that the person can listen to the directions of the facility. So it may be something as simple as like when you get to the front desk and you want to go to this department, you're going to turn to the right, walk 50 feet, and then take a left. That is a great thing to have on your website. So before the blind person even gets to your facility, they can listen to that and get an orientation about where they need to go, how long it's going to take them to get there. Also, if you have the cafeteria in your facility, that's a great thing to point out to the blind person because we may have an appointment that can take a couple hours where there's a break in between and we'd really like to get something from the cafeteria. So if you have that available, let that person know that that is an option for them. Another thing is to be a little bit lenient about showing up late for an appointment. A lot of blind people rely on a paratransit system, which has its own issues. So if a blind person gets there and they're like, oh, I'm really sorry, I'm late, my ride was half an hour late picking me up, please don't cancel that appointment on them. Again, it's the blind person's responsibility to call you and tell you, I'm running late, my ride is running late, please keep my appointment open. Um, I find that uh, a little pet peeve because um, a lot of times we'll wait in a waiting room for a good 40-45 minutes before we get called back anyway. So if we're late because of a ride, um, please understand that that can happen in the situation of somebody who does not drive. So the last thing I wanted to talk about is technology for people who are blind. So there are many apps out there that assist us with medications, with appointments, with our general health. One of those is called Aira, AIRA, and that, excuse me, is an app that will allow us to connect to a sighted person. And Aira agents are paid employees of the company Aira. So that is a subscription-based service that a blind person must pay for. And we are connected to a sighted person who can help us with mobility. They can help us with reading a form. They can take over our computers and help us with something that isn't accessible. So if your form isn't accessible and you didn't call Matt Ader at Vispero yet, they can help us complete that document. Another app is called Be My Eyes. So Be My Eyes does the same thing as Aira, except they're all volunteers. There are literally millions and millions and millions of volunteers around the world that have subscribed to Be My Eyes to be a sighted volunteer. So a person would use an app on their phone to connect to that person, which is great. They can also help with all those same things. The only thing is I caution blind people that these are volunteers. They're not bonded. They're not part of a company. So be very careful what you show them. Don't show them any financial stuff. Don't show them any personal stuff. But as far as, what office building is this? Or can you help me navigate this website? It's a great service. So Be My Eyes also has a new component called Be My AI, which will allow a blind person to take a picture of something and get an amazing audio description of what they see. So if it's a form, it'll tell us what's on the form. If we walk into an office building and we snap a picture, it'll tell us where the front desk is. So it's an amazing app. And then the last one is Seeing AI, which was designed by Microsoft. And it is all AI based. So it's got the ability to read text, it's got the ability to tell me what's around me, it's got the ability to read currency. So those are apps that are great as far as healthcare because I could read my medications. I could read a letter that was sent to me from a doctor. And all that leads to the point of confidentiality, privacy, and dignity. It is very undignified to have a person in your family fill out a medical form for you because there's certain things that we don't want people to know about our medical condition. I mean, just some of the questions on these forms, I do not necessarily want my son to have to fill them out for me. So having an accessible format for a blind person to do this on their own is so crucial because it gives us our privacy, it gives us our dignity back. And it's also confidential. You know, there's stuff we don't want out there for the world. Yeah, I could use an IRA agent to fill this stuff out, but do I really want them to know all these medical aspects? So that is why I strongly encourage and plead with you to get your websites, get your online forms in an accessible format so that we can maintain our privacy. So that is pretty much what I have to say about the healthcare system. I mean, I love all the hard work that everybody puts in, and I applaud those who have done the right thing and made your websites accessible, made your healthcare facilities accessible, educated your staff. And I look forward to those who are going to work on those issues. So I thank you.
All righty, I guess it's my turn. I'm going to be talking about hearing loss. As Nui said at the beginning, I do have a bilateral hearing loss, and I've worn 2 hearing aids since the age of 5 when I was diagnosed. I think that I kind of consider myself a veteran of hearing loss, so a lot of people who are new to hearing loss, I end up giving them tips on how to adjust with hearing loss, and that's what I did in my prior job for roughly about 14 years combined. And a lot of times people will call my office to get input assistance for their loved ones, and a lot of information that I've compiled today is part of that information that I've given to other people over the years. Just some quick stats on hearing loss. This is from the Hearing Loss Association website. More than 50 million Americans have some degree of hearing loss. That's about 1 in 7 people in the US. That's from the National Institutes of Health on Deafness and Other Communication Disorders in the US Census. Hearing loss is the 3rd most common chronic physical condition in the US, twice as prevalent as diabetes or cancer. Hearing loss is also associated with other common health issues such as diabetes and heart disease. That is from the Hearing Health Foundation. Hearing loss is on the rise and expected to affect 2.5 billion people worldwide by 2050 from the World Health Organization. 65.3%, 21.5 million people 71 years or older have hearing loss in the US, according to the Journal of American Medicine Association. 1 in 500 infants are born or develop hearing loss early in childhood, and more than 1 in 10 children and teens 6 to 19 years of age have some degree of hearing loss from the American Speech Hearing Language Association. And that's going to get worse over time as people are using more earbuds pieces and listening to high volume using those devices. One thing I like to think about with hearing loss is who to think has hearing loss. It could be a patient, it could be their caregiver, it could be a parent of a child, it could be a family member, a staff member, a nurse, or a doctor. And every one of those situations has a different accommodation. Unfortunately, I don't have a whole lot of time to get into each one, so I'm just going to come from the patient side of it. Areas of concerns that we have about hearing loss is focusing on providing access in all situations where communication occurs, where any talking, any exchange occurs. We really encourage people to establish good communication rules. One of the pet peeves that we have is that sometimes people shout at us and they talk loud at us, but the thing is that kind of accommodation doesn't help us understand, because we can hear you, but that doesn't necessarily mean we understand you. And that's the difference with hearing loss. That's why devices like hearing aids and assistive listening devices are so important, because it brings the sound closer to our ears so we can understand you. We ask that you ask what is needed from them, because everybody will have a different situation. Everybody has a different type of hearing loss. Everybody has different skills. Do not assume a sign language interpreter is always the solution. As Diane found out, they thought that was the solution for her. Well, it's definitely not the solution for me either, because I am not a native signer. I do know sign language, but I'm not fluent. And that's not my first mode of communication. Most people with hearing loss that were a part of our organization were oral first. And so they have no need for sign language. So sign language interpretation is not always the solution. You must consider sign language and any other type of interpretation, video relay interpreters, hearing assistive technologies, any other modifications to help aid communication. And, just be flexible with it. Unfortunately, there's not one size fits all. Every situation is different, so you may not always be able to provide the accommodation, so there are ways to get around it. And it's also a two-way street. One of the things that we always encourage, just like Diane said, is encouraging our community to be staff advocates. It's a two-way street with communication. And unfortunately, a lot of people don't understand that until they're given tips. And these are some of the tips that we've given people over the years at HLAA. If you are someone that's speaking to someone with hearing loss, get the listener's attention before speaking. Tap them on the shoulder, get into their, view, let them know that you're talking to them. Face the listener to facilitate speech reading. Speech reading is something that we read the face, we read lips oftentimes. I myself have read lips for years. I was taught speech reading as a young child, so I use lip reading all the time. But I also use visual cues, so it's important that I see the whole face. Avoid speaking from another room. It's going to be mumble, mumble, mumble. It's not going to be anything from another room, unless maybe we have a cochlear implant. Maybe we've developed our ability to hear better with the cochlear implant, but that's not necessarily the case. Speak clearly at a moderate pace without yelling. As I said, shouting and yelling doesn't necessarily enable the understanding. We really appreciate not chewing or covering your mouth while talking. Repeat or rephrase as needed. Just say what the information a different way. Be patient and respectful. Do not use dismissive comments such as never mind. That is a major pet peeve for me, even within my own family. My son will say that to me, and I'm like, look, if you want to say something and it's important to say it in the first place, please repeat it. So every communication that we miss is so important to us because it's a loss. So something to keep in mind. If you have hearing loss, we ask them to tell people that you have hearing loss. Let them know that you have hearing loss. Express your listening needs clearly. Find a quiet, well-lit spot for conversation. Listen actively and look for visual cues. Admit if you missed something. Ask questions and don't bluff. That can be a problem, because oftentimes people with hearing loss, they bluff a lot. They think they're listening, they're hearing it, but they're not really. Use assistive listening devices or other technology. Plan ahead for difficult situations. Okay. As I was going through this, I knew I wasn't going to be able to cover a whole lot of solutions, but I would just pick up on a few that could help right away. I know one of the things that we have trouble with people calling on the phone. A lot of times people that called on the phone, they themselves had hearing loss. So oftentimes they could not understand somebody on the other end. And when you don't have a hearing aid, the hearing just becomes very difficult in a conversation to talk. So oftentimes I would try to raise my voice, give them a little volume, but the really good thing would be to consider is a voice amplifier microphone headset for people who are receptionists. And if they could have an amplified microphone, they can amplify their voice so the other person on the other end can hear them. And that's a separate microphone aside from their existing system. So another issue is I know that I said, please don't cover your mouth. Where on the healthcare facility situation, the biggest issue is the mask. When COVID hit, our community was just in an uproar because we had enough trouble just understanding people normally in communication. But when the mask came into play, it became a huge barrier to communication. And a very frightening one because oftentimes people had no idea what was being said, what we're doing, and people were not willing to lower their mask so we could read their face. So it was very difficult. So one organization called Safe and Clear developed an FDA-approved clear window mask. And before they did this, we had a lot of home sewers that were trying to do clear window masks because at one point Safe and Clear had no supply because everything was going to the medical community. So but now I think they have enough supply, but they do have 2 FDA-approved masks to help. The clear window enables speech reading and facial cues, so it really helps. It's not a replacement for captions and voice because the voice can still be very difficult to hear. The mask, even though you can see it, you still can't hear. And oftentimes in some situations, you have double mask. So that even hinders the voice getting to the patient even more. So really important to consider that accommodation as well. Having more accommodations, such as maybe speech to text app on a lap, a ThinkPad or a phone, to consider those adjustments as well. For a front desk reception area, there are availability of hearing counter loops. These are, you can see at the bottom there, it's a hearing counter loop where if you attach it to a microphone, a person with a hearing aid or assistive device, maybe a cochlear implant, can turn on and they can hear the microphone so you can hear what the receptionist is saying. We've had a lot of our advocates advocate for that, but it's been hard to get that accommodation. In lab room, exam rooms, outpatient discharge, we just encourage people to use communication tips and just be respectful of hearing devices. Oftentimes, many times, our community members had said that if they were in a outpatient facility or in a hospital setting, especially, oftentimes their hearing aids would get lost in the laundry or taken on the food tray, and they would be out their hearing aids. And these hearing aids are not cheap. They're like $8,000. So for 2, I wear 2 and it cost me $8,000. So I don't want to lose those. So very important to be respectful of those glasses, whatnot. It can be difficult, but we also encourage our community members to make sure that they're responsible for that as well. Make sure they let the providers know that their devices need to be put somewhere separate so that they don't get lost. Telehealth is a huge issue for our community. When telehealth first started with COVID, there was absolutely no access and captions. We were very lucky to have had Petition, Google, and Zoom at one point, and they had provided free captioning on their platforms. But the telehealth platforms are a little bit more trickier to provide access to. And it's one thing that we've been encouraging our community to advocate for with their local Congress to try to get that accessibility done. I know when I worked with the veterans group, with our volunteer group, they were saying all the time, the Veterans Administration, they just did not provide captioning on their telehealth, or they had very much difficulty with their accommodation. So there is a communication access plan that we encourage providers and patients to get a hold of. Hearing Loss Association of America has worked with various folks like the Center for Medicaid and Medicare. They have on their guide, they have information about communication access plans, sample forms, tips for providers and patients, and suggestions on accessibility options as well. And those are, I have that in the resources at the end of my talk as well. Old school always works. Pen and paper works. Whiteboard works. As I mentioned before, tablets and smartphones with speech to text apps. I know that live caption is a hearing accessibility option on many new phones right now. Many smartphones have that. If you go to the accessibility options on your phone, everyone should have access to this. They have live caption that you can under hearing enhancements, and then it will caption phone calls, caption anything that you play on your phone. So that is always an option. When communicating with someone back and forth, though, it can be a little bit difficult. They do have on the live caption, they have a microphone caption option. I do not know they have that on iPhone. I'm not sure about the Android. But on the Android, there is also live transcribe. I've used that myself when I've, had to deal with immediate situations, and I'll turn the live transcribe on, and I don't know if you can see that, but it will automatically caption conversations that you're involved with. So it always helps in a pinch. We always encourage using video relay interpreting, computer assisted real-time captioning, also called CART. Those are person-aided transcription services. We rely on them a lot in our meetings and our business meetings, and also for one-on-one meetings with providers, especially when there's a lot of context and terminology to be exchanged. It's a little bit easier because oftentimes the speech to text apps that are AI generated, they may not always have the right terminology. Hearing assisted devices are also encouraged as well. Many of folks that have hearing aids right now, they actually sometimes get a microphone that's specific for their hearing aids brand. And so we encourage you to use that, be willing to use that. Also, there's a very old school assistive device called Pocket Talker. If people don't have hearing aids, if they're having difficulty hearing, we always encourage that as well. It uses a headset with a microphone, so that's always another option as well. A more technical option is UB Duo. It's a machine where you type back and forth to each other. This works well in offices, one-on-one, any one-on-one situation. It works well, so that communication is easily understood between people one-on-one. Alrighty. These are the different guides that I pulled together for you. Communication and Access in Healthcare is that grassroots program where a lot of our members have been advocates in the local hospitals to try to help get them accessible. And this volunteer committee developed this communication access plan, and it's also featured in the auditory sensory brochure from the Center for Medicare and Medicaid Services. There's also a communication access guide at the American Speech Hearing Language Association. I actually found a auditory sensory disabilities brochure as well for blind, for vision impairments. We encourage products to be found locally. They could be at the Maryland Technology Access Program. They have an AT library online that shows you different devices that they offer through that program. They also offer for a lending program for actual people with disabilities that need theirs, that they can try them out before purchasing. I know that the independent living centers, I know the Freedom Center and Frederick offers devices. I'm sure Diane's Image Center offers that as assistance as well. There are private companies that offer products. Diglo Communications, Hear World, and Hear More are also other options to find products. I just was thinking to share a couple of videos that I thought were pretty important. The Northwest ADA Center made a video on effective communication in healthcare under the ADA, and it was a very informative video. There was also one of the chapters in HLAA It was a chapter in Chicago, the Chicago North Shore chapter, and they had a very successful volunteer hospital program where they connected with the local administrators in their community, and they had an annual meeting where they talked about all the progress that they were doing on creating communication access, and any issues that came up, they would address that with the community. And they ended up doing a video nationally, and I gave you a link to that video. It shows, what the administrators have done. There's different hospitals from across the country that are represented in that video. So it's very informative. There are also articles. One of the things I thought would be interesting would be articles from the personal perspective of the patients, what they went through, and also providers. And there's a bunch of different articles on the HLA website under the communication access section that talk about those situations. There's also a Live with Hearing Loss blog. One of the board members from HLAA, Sherry Ebert, she's wrote an article about hearing loss in the hospitals, how she was coming as a parent. And her daughter had to come with me, and it was very interesting article. I actually did find a little bit more of a technical article on disparities for the deaf and hard of hearing and vision at the NIH website as well. So I have those here for you as well. So I hope I covered enough for 15 minutes. So I hope that information was helpful for you. So I'm going to go ahead and stop share. Okay.
Hi, everyone. Can you see my screen? All right, perfect. Thank you so much for that very insightful presentation, both Diane and Carla. I really appreciate it. So the chat is disabled. However, you can send a message to myself or Julie if you have any questions. So I'd like to go ahead and open up this time for questions from our audience. And please feel free to use the chat box. It will send to me, and then I'll be able to read it off to Diane and Carla. Okay, so we have our first question. Um, Maria Cruz says, very helpful tips. Could you recommend any tools, devices, or programs that support individuals with language delays? I'm especially interested in technology, learning apps, or websites that are user-friendly and effective.
I'm gonna pop up language delay in terms of not understanding speech. Is that what that means? Okay, I'm just going to assume that. I know that some time ago, Google had developed a app called Google Relate that would help people with able to be better understood. The program has matured since then. So Google Relate is a training program for voice where they would actually be able to train the program to translate the speech that you're saying. And it does take some time, but it is available. Google Relate. I don't know if it's the same name right now, but that's the only one that I'm aware of.
Okay, and Maria follows up by asking, do you have the link for
Uh,
this resource?
I think if you just type in Google Relate in Google, it should probably come up.
All right, thank you for that question, Maria. Does anyone else have any questions? Go ahead and feel free to type those in the chat and I'll read it out to Diane and Carla. Also, feel free to use the raise your hand function, or you can come off of the mute if you have a question as well. All right, final call for questions. And if you have any questions that you can't think of right now, the contact information will be sent out to you all, and you can also find it in the speaker bios on our website. All right, if no one else has any questions, I will proceed with concluding our webinar session just with a few updates. So thank you again to our speakers for such a thoughtful and engaging presentation. As we wrap up today's webinar, a heartfelt thank you to everyone who joined us. Your energy, engagement, and commitment to advancing health access and technology is truly appreciated. Before we close, I want to share a few quick reminders and upcoming items. Also, Julie has sent our brief survey for this session in the chat as well, and I will mention this in a brief moment. So continue learning about the future of health and technology by joining us for our remaining sessions for the Empowering Health webinar series. Our next session is on May 30th, which will be covering tech literacy in the digital health era. So we're hoping to see you all there. If you'd like to get in touch with Marylanders Online, you can visit our website. We also have an email, which is marylandersonline@umd.edu, and we have a toll-free tech helpline, which you can contact on Monday through Friday from 10 a.m. to 8 p.m. and Saturday from 10 a.m. to 5 p.m. Our program is also on all social media, which you can scan our link tree to access that. We're on Facebook, Instagram, LinkedIn, and we also have a newsletter sign up to find out more about our program and upcoming events. And please look out for a follow-up email from Marylanders Online to complete our survey, which you can find on this slide or in the follow-up email we'll send out. Also, if permission was given by our session speakers, which this session is, a recording of this session will be found on the Marylanders Online YouTube page. So we hope you leave today feeling more informed and inspired, and we ask you to take care, and we look forward to seeing you at our next session. Thank you, everyone.
Thank you so much. This was awesome.
Thank you, Julie.
Thanks, Diane. Thanks, Carla.
Thank
Thank
you.
you.